Video 2. Cleaning the site. It's important to clean the skin around the G-tube site to keep it dry and prevent infection. Clean it 2 times a day or more often as needed if it is dirty or leaking. 1 week after the G-tube has been placed, one of the cleanings can be done during a shower or bath. To clean the skin around the G-tube, you'll need a cotton-tipped swab or gauze pad, a clean, soft cloth, a small bowl or cup, gentle soap, and tap or bottled water. First, wash your hands. You will see your healthcare provider wearing gloves when touching your child's G-tube, but you do not need to wear gloves when caring for your child's G-tube. Add gentle soap to a small bowl of warm water. Dip the swab, gauze pad, or soft cloth into the water. Using the swab, gauze pad, or soft cloth, clean around the stoma or hole where the G-tube goes in. Remove any crusting or fluid. If it is hard to remove crusting, you can soak the skin with a warm, wet cloth for a few minutes to loosen the crust. Use a wet cloth to wipe the soap from the skin. After the skin is clean, dry the skin with a soft cloth or towel. Do not apply creams or powders unless your child's healthcare provider tells you to do so. Leave the G-tube site open to air unless your provider tells you to cover it with a dressing. Next, clean the balloon port. The balloon port is only used for checking the water in the balloon, replacing the balloon water, or removing the balloon water. Last, open the G-tube cover to clean the top of the G-tube with a swab, gauze pad, or soft cloth. Do not push the swab or other objects through the opening in the G-tube. Keep the G-tube cover closed when you are not using the tube. Unless your child has stitches that you can see, start turning the G-tube 1 week after it is placed. If you see stitches, wait until they are out and your care provider tells you to start turning the G-tube. It might be more tender at first and a bit uncomfortable for your child, but the G-tube should rotate easily. Turn the G-tube slowly all the way around in a full circle once a day or as often as instructed by your care provider. If the G-tube does not turn easily in a full circle, please call your child's provider when the office is open.